incidents, which is funny.
All right, I hate to cut everybody off.
Okay.
But we're gonna get started. Hello, everyone. I'm sure everybody knows me by now. Laura Vilwalk. I'm with Direction Home Akron Canton Area Agency on Aging and Disabilities. Thank you so much for being here today. It's a rainy day, kind of gloomy, but it's Memorial Day weekend, so we can honor those who have fought and died for our freedom. And I hope you all can celebrate their lives and celebrate their gift to us this weekend. We're going to start as we usually do, except Carla is not here today. She has some family matters that she's attending to today. So you all get to listen to me more. I know that that is what everybody wants to hear, is more Laura. So we're going to talk a little bit about Direction Home, just to give you an overview in case you are not sure who we are and what we do. Direction Home, we are a 501c3 area agency on aging. The area agencies on aging were created when the Older Americans Act was put into action. There is an area agency on aging in every county across the United States, and we are created in order to assist older adults, and Direction Home has, I don't want to say recently, but in the last 15 years has added disabilities to our name, because we have several programs that also assist individuals with disabilities and regardless of age. So, we're both. We're Area Agency on Aging and Disabilities. Some of our most requested services that we provide and that we arrange are transportation, nutrition, especially home delivered meals for those who can't go out and can't prepare their own meals, utility assistance, chore and homemaker services for those who can't really get around and clean their own home, do their laundry, those kinds of things. Emergency response systems, and thank you so much to all of you first responders out there who have those emergency response programs, helping individuals get those devices and to make sure that they are working properly. And of course, supportive housing, those individuals who need a little bit more care than what they can receive at home. Who we help, we have several different ways that we help individuals. The first one would be our Aging and Disability Resource Center. We receive over 12,000 calls individuals who call in for information and assistance. We also assist more than 11,000 Medicare patients. We help them avoid hospital readmission. We assess more than 10,000 individuals in the community every year, and that is in Portage, Stark, Summit, and Wayne counties that we cover. Right now, we are still doing things over the phone. However, once we go back out into the community, every one of those assessments would be done in person. We have over 7,000 individuals who receive care through our agency, managed through long-term services and supports. There's over 2,300 attendees of continuing education classes for social work, nursing, and counseling professionals every year. Thank you, Lori, for that. Our Aging and Disability Resource Center provides a lot of different kinds of information to the community. You can see all of them there. And if you have anyone that you come across that you think could use some assistance, please have them call our Aging and Disability Resource Center. That is 877-770-5558. Our care management programs, we have several. We work in partnership with different managed care organizations. We work with CareSource. We also work with United Healthcare. And we work, of course, with the Ohio Department of Aging and the Ohio Department of Medicaid. Care management. We also work with the state and federal government on the passport program. I'm sure that many of you are familiar with that. The passport program helps people get meals, they get transportation, home health care, chores, and home care services. We also assist with assisted living and care coordination. Care coordination is that program for individuals who don't qualify for the Medicaid programs, but they also can't afford them on the private pay basis. Our Elder Rights program is the program that covers nursing facilities, individuals who are in a facility or who are receiving home-based services who have a conflict of some sort, they have a complaint. And so our ombudsman will assist those individuals in resolving those complaints and working with the providers of services and the individuals receiving them. We have a foundation, it's the Direction Home Akron Canton Foundation, and it assists those individuals that we talked about with the care coordination program, those who can't afford private care but don't qualify for Medicaid. That is the basis of the foundation. And it also assists with advocacy for those issues affecting older adults and individuals with disabilities. All right, so next up, we are going to have Tracy Nauer. She is our Director of Complex Care. She is going to be addressing an issue that was suggested after, I can talk today. After our last meeting, we had a suggestion that we had.
Oh, you went on mute, Laura.
Yeah, I'm sorry.
Look,
That was me. I was trying to let somebody in and the screen jumped just as soon as
You're good. So Tracy's going to address the reducing non-emergency calls to emergency numbers. Thank you, Tracy, for being here today.
You're welcome. Happy to be with the group. Nice to meet all of you. When Laura asked me to do this, I'm like, oh boy, I'm certainly not an expert with, emergency dispatch services, but I think we are pretty well positioned to help you guide these folks where they need to go when they call quite often. So go ahead, next slide, Laura. So we're going to talk today a little bit about what's an emergency call, what's a non-emergency call or situation, maybe what are some common reasons for these calls, some communication tips, some anticipatory techniques that you could use maybe to assist in reducing these calls, and then some resources and referral sources. So you all are probably more knowledgeable than me on the definition of emergency and non-emergency situations. Some examples I think of like an emergency situation are obvious things like someone not breathing, maybe a fall with a known injury, car accident, those types of things. And then non-emergency situations I think of are a fall with no identified injuries, they can get up off of the floor. Maybe somebody's complaining they're just not feeling well today, sore throat, that kind of thing, a headache. But I challenge you to think that sometimes those things, while they might seem non-emergent, could turn into emergent situations and we just aren't aware of it. So you think somebody who's fallen, can't get up, they may not be complaining of pain, but as soon as you go to move them, they might be in pain and maybe potentially have an injury. Somebody with a headache, is that the start of a stroke? So you have to kind of think about those things as well. Is it really a non-emergency situation? Okay, Laura, next one. So some common reasons someone might call for non-emergency reasons. Think of, they don't know who to call. They don't really have a support system. Maybe they are non-English speaking, or, I don't know, they don't have a primary care physician, so they don't have a doctor to call. They have anxiety, they're depressed, they're lonely, or they're confused. Might be some reasons you see frequently, and certainly open to some other categories of calls you guys might get when we get to maybe some of the questions phases of things. So some things you can do when you have this person on the phone. And again, I'm not an expert in emergency dispatch. I'm sure you don't have a lot of time to be on the phone with these folks, but maybe think about asking some open-ended questions. A question that doesn't solicit a yes or no answer. Maybe asking, well, what is happening? Why is that happening? Tell me more about that. What's different today than yesterday? Maybe asking, well, why is he or she, acting more differently today? What is that difference? How are you feeling right now? Or some of those open-ended questions. Asking if they've called their doctor already to report the issue. Do they have a family member or friend or neighbor, anybody that can call to just come over and check on them? And then, are they currently connected to any services that come to visit them at home? This is really important. A lot of times, folks, even who have our services, forget to tell people, oh yeah, I have that care manager that comes to see me, every few months, or yeah, that home care nurse just came yesterday. So trying to word it in a way that will make them think, yeah, I have those people that come to see me at home. Maybe I could call them. Okay, next. So trying to anticipate the needs. I'm not sure if you have like a tracking mechanism you could put into place to say, Mr. Smith calls every month on Tuesday, the first Tuesday, or Mrs. Jones calls every week on Friday. To just see, when is there a pattern to that person calling at all? The same day, the same month, that kind of thing. Do they have the same need when they call, or is it different needs every time they call? So if you can identify those things, is there a way to initiate a call to that person in anticipation that they're going to call? So if they call every Friday, you give them a call on Thursday and just check in on them. Is there somebody available to make a routine visit to the house? Is, a support person at the department able to just stop by and just check in if they call on a certain day every week? And then thinking about, well, what additional supports might need to be added or could be added for this person? Go ahead and next slide, Laura. So when we think of additional supports, obviously, in addition to our agency, think of your local 211 numbers that you can direct people to, or maybe if you find out the problem, you can make a follow-up call to 211 to see what resources might be there. Our local community mental health providers are fabulous. They are full of great resources. Check in with those. I think of community support services, Portage Path Behavioral Health, Coleman Behavioral Health Services. If you think someone has some mental health conditions, obviously suicide hotlines, if you think someone is thinking about harming themselves, and obviously dispatching police or EMS if that's a possibility. Our wonderful Ohio Department of Aging has some programs in place for individuals who are lonely, and that program's called Staying Connected. We have a similar program here at Direction Home called Direction Home Dialers, where we have people that will make phone calls to these individuals on a routine basis for some of that socialization to help minimize that isolation. And then, as Laura said, when in doubt, just call us. Or have that person call us. We have a plethora of services and supports for people. The options are really endless, and our wonderful ADRC staff go through and talk with that person really to try and get to the in-depth of what's going on and how we can help. And we try and make that easy. There's an email that can be sent, or that phone number that's in the chat. We're like that one-stop shop. When in doubt, just call. And I think that was quick and fast. And any questions or situations that you want to talk through, anything like that? Quiet group on a Friday.
All right. Well, thank you very much, Tracy. Appreciate it so much.
Welcome.
One of those questions, I mean, it takes up so much time when there's a non-emergency call on an emergency number. So, you know, the more that we can build our partnerships, you know, the better it would be. And we want to help our first responders because they're the ones that are out there when we can't be there. So please let us know, let us help. All right, so we are moving on to our next one, kind of related. The American Red Cross has many different kinds of programs, and they have a program for disaster and emergency preparedness for older adults. We have John Garris with the American Red Cross with us today to talk to us about the program. John, thank you very much for being here.
Thank you for inviting me. It's something that all of our agencies work on, and this is a presentation on Be Red Cross Ready as a series of disaster preparedness presentations the Red Cross puts together on a litany of disasters, from tornadoes to fire safety, etc. And this one's geared towards older adults that we do. And so I'm going to do the presentation. It's designed, I'll try to tweak it a little bit so I'm not insulting anybody here, because I know all of you work with adults already, older adults. And being one of these guys, we also, I'll not hopefully insult your intelligence, but I think it'll piggyback with a lot of the services that all of you provide already. This is just a way that we're educating folks with the Red Cross. A lot of people see us responding all the time, but some of the things, a lot of what we do is train folks so that they can be self-sufficient as much as possible, at least recover from a disaster a lot easier. So this is Be Red Cross Ready for older adults. Next slide, please. So we're going to talk about emergency preparedness. Yep. Okay, we're going to talk about emergency preparedness for older adults. And as we all know, disasters can directly affect daily life, and it can happen anytime. I always like to say people don't plan to be in disasters, they sometimes find themselves in disasters. And some of these disasters happen without little or no warning. But there are things that we can do to be prepared and respond safely and even help speed up the recovery. And this presentation is really designed to give some practical tips on how to plan and how to prepare your needs in an emergency, specifically for older adults, because let's be honest, older folks have different needs. They have more specific needs, a lot of times health needs. They may not have a resource system any longer, or very few, or they may be single adults that live by themselves and are reliant on caretakers and neighbors or whoever. So no two people are the same. And we're going to talk about helping people assess their abilities and potential and the potential conditions that they may need to consider in the event of a disaster. And we're going to provide them some of the key actions and steps to take before, during, and after an emergency. And older adults, as we all know, they're assets in the community. And a lot of times we look to them for guidance and wisdoms, and they have unique gifts that they can provide the community even after disaster. And we're going to hopefully see yourself, the adults, as such that they're such and prepared to be useful if an emergency occurs. I will say from a Red Cross standpoint, most of our volunteers tend to be seniors, retired folks that have left the workforce, the day-to-day grind, but some of our volunteers they put in more hours than paid staff. And the bulk of our volunteers are seniors, elderly folks to help us that still have things to offer the community. And so hopefully this guide will prepare them to be ready again before and during such an event occurs. Next slide, please. So throughout this presentation, I'm going to be specific actions they can take before, during, and after an emergency. And we're going to discuss actions that they can take before an emergency so they can get prepared now, today, when although it's raining outside in Northern Ohio, this weekend's going to be nicer. And those are the times that we really need to take those actions to prepare now. The worst time to prepare for an emergency is during the emergency or while it's happening. We saw this last year in COVID. I always like to tell people about planning, and that's part of what I do with the Red Cross. And that's really what I do, is prepare people, is think about what situation, regardless if it's older person or younger folks, think about your situation, your own personal situation. How prepared were you when COVID hit and you had to, shelter in place and social distancing? And did you have supplies? Did you have emergency kit? What kind of impact did it have? Can you get to your doctor and things? So I always like to put it in the context so people can relate to it, is how prepared were you last year this time than you are today? And I guarantee we're a lot further ahead than we were, but unfortunately we have a short memory, and people, they will fix things right after an emergency, and then we tend to go backwards. And so it's important to not only identify what could happen, but to plan ahead. Actions to take during an emergency, so you know how to respond, and actions to take after emergency, of what they can do to start recovery. And I think most people understand basic safety. We've, from little kids to senior adults, we talk about fire safety and tornado safety and things. It's the common sense thing, in my opinion, and I've been with the Red Cross a long time. I commonly see people do the worst with common sense things, things that they think they should know. How many of us have smoke alarms in our home, and how many of us test them monthly? There's reasons to do all that. So it's important that there's things that we can do, again, before. There's actions we can take during a disaster, and then obviously to help recover after an emergency happens. Next slide, please. So we're going to talk about some of the major actions they can take now to prepare for an emergency. And we're going to talk about these a little bit more in detail. Number one is getting informed. In my opinion, I think the number one thing, I always ask people, what is the number one thing people want from Red Cross in a disaster? And I always say it's information. What's happening? When can I go home? Where can I get help? What kind of help can I get? Who's there to help? Those kinds of things. So information is critical in any disaster of what's going on. It's important that they learn about their area, what kind of disasters or emergencies could happen, what's most likely to happen or occur there, what resources are available in the community. And in groups like, the Agency on Aging, a lot of the groups that you're involved with, the first responders, the hospitals, their doctors, those are all part of that resource network that they need to know how to contact those folks in an emergency, and keep on top of that, keep it updated on it, and not just rely on when it happens. Hopefully somebody's going to pick up the phone and respond to you. So assess what your needs are is important, and consider your individual needs. As said earlier, no two people are alike. Assess what resources are immediately available to you and what you would need in an emergency. We get so complacent now, even things like cell phones. We put so much information on our cell phones and the internet. And, in the old days, we had pen and paper on it, and we had lists of phone numbers. But think about it. If you lost your cell phone or your battery died in your cell phone, would you remember the phone numbers that you need to call, the important numbers, even your kids and so forth? It used to be inbred that we learn those numbers and those things to do, and we get so complacent on it. So think about backup plans, so you have a redundancy that you can do it. Assess your needs, and then what you would do in an emergency. And then build your support network. Identify helpers in your life that can not only discuss and put a plan together, but develop that plan And think through what you would do in an emergency occurs. If you had to evacuate, or if it's sheltering in place, like I said, we had a lot of experience this past year, and how to protect yourself and your property in each instance. A communication plan. I think we're still on the last slide. Create a communication plan. Make sure that everybody in your support network knows what your plans are and knows to be contacted in case of emergency. The call tree, we've all done that before. Having that buddy system. I always go back to simple things as saying, how well do we know our neighbors anymore? Growing up in the old, when I was a kid, you knew your neighbors and everybody looked out for each other. But how many of us do that today? So build a resource plan, create a communication plan, gather the supplies you need, and assemble an emergency kit. And the Red Cross and FEMA and a lot of agencies like that will give you all kinds of lists of suggested items to put in an emergency kit. And we always get the kickback that I can't afford to buy a kit. I can't afford this stuff. But I would say that 90% of the things that you need in an emergency kit, you already own. It's a matter of collecting it, putting in a container, putting it in a common area so that everybody knows, checking expiration dates, things on medication, especially with elderly, or food. A lot of times people, can food, or you hear the old war stories. We had the MREs that people had on their shelf for 30 years and tried to eat them in an emergency. Some of them work, some of them don't. But everything has an expiration date, even bottled water. And we try to remind people that if you've ever had a bottled water and it tastes plasticky, check the expiration date. It's probably outdated. It may not kill you, but it's probably not going to taste so great. And then minimally, and lastly, prepare documents that you're going to need. The important people, if you have lease agreements, insurance documents, your doctors, the important phone numbers, and all that important paper, have backup copies of it. Have the originals in a fireproof box that you can grab and go if necessary, but have copies of those and keep that in your emergency kit and leave it with family or friends, somebody you can trust in case that's lost in the fire. One of the things that we do when we help families after home fires is trying to recover. If you've ever had to get your license replaced because you lost it or outdated, whatever, and think about all the credit cards and all the insurance cards and all the medical cards you have. It can be a daunting task for anybody, let alone an older adult. So maybe have copies of those things so that if you lost them, it's going to be a lot easier to replace those items. Next slide. So it's, again, like I said, it's important to understand what emergencies could happen in your community. Obviously, we don't have to worry about hurricanes in Ohio, really don't have to worry about wildfires, but think about what happens here. We get tornadoes, we get flooding, single family fires, the #1 disaster the Red Cross responds to every year, and a lot of you do. It's the #1 disaster that could affect everybody. So think about what could happen and understand what kind of things, what actions you would take to prevent being a victim of a disaster, and what you would do if it occurs. Learn about your community, about the housing response plans, and find out what your community's guidance are for response plans, evacuation routes, which we always advocate people listen to the authorities. They're going to give you the quickest way out of town if they're telling you to evacuate. Don't think that you're going to take a quicker route. They're telling you to take certain routes because it's the safest route. So listen to what the authorities are saying. Know what available resources are preparing for disasters of it. If you live in a housing community, such as an apartment building or assisted living, find out about the manager's guidance and what their plans are, what they plan to do, and how they plan to respond to emergencies or disasters. Sign up for alerts and warnings. A lot of some communities have a reverse 911 where they will call you if there's an emergency. We deal with in Northern Ohio, or all Northern Ohio. A lot of people don't know we have 4 nuclear plants in our area. We have Beaver Valley, which is technically in Pennsylvania, but the EPZ zone reaches into Ohio, almost into Canton. We have Davis-Besse out in Sandusky. We have Perry Nuclear in Painesville. We actually have the Fermi plant, which is in Monroe, Michigan, but that's part of our jurisdiction. And those are all around Lake Erie. And why I mentioned that is, and hope to God they never have a nuclear accident, but we respond to those. And Red Cross is a part of their disaster plan for evacuation. So understanding what could happen in your community and how you're gonna, how do we respond to those things is important to do. So signing up for those alert and warnings that the community, your first responders, your fire, your police, your EMAs will contact folks. It's a sign-up system in a lot of communities, and basically will send out emergency broadcasts, almost like an Amber Alert to folks for communities that have those. Understanding what a watch and a warning means for things like tornadoes and floods and so forth. You know, watches, getting ready. You know, something could happen. A warning is it's happening. Take action. It's important to do. And then get trained in simple things like first aid or CPR, knowing some skills that if you need to take care of somebody or need to take care of yourself, you have some of those basic skills that, you know, you can take care of. Because a lot of times, even though we're lucky in the United States, we have a lot of first responders. A lot of you are on here, are those folks. We're sort of complacent in the sense that we know we can pick up the phone and the EMS will be at our doorstep in a few minutes. But think about in a large disaster, if everybody picked up the phone, the EMS, there's only so many of them. So the more we can be resilient, the more we can be self-sufficient, the better you're going to recover from any kind of disaster. Not that they're going to overlook you, but you may not be on their pecking order. You know, it's almost a triage type of a thing. They're going to get to the people as quickly as they can, but you know, it may take some time, and it's a fact of life. There's no two ways about it. They're doing their job and they're doing it very well, but the more we can take care of ourselves, the better they can take care of the community as well. So learning some things are proactive things that we can do. Most disasters are specific actions to take to prevent yourself from the impact of a disaster, like an earthquake. It's drop, cover, and hold. Tornadoes, get to the lowest level. You know, fires, single-family fires, don't leave unattended cooking. Most common place a fire happens is in the kitchen. It's the most common response that the Red Cross responds to every day. You know, those are kinds of things we want to do. In addition to the basic guidance, there might be alternative actions to do, especially if with elderly. You may need to stay in bed if something's happened. Cover yourself and protect yourself from falling debris. Or if you're in a wheelchair, lock its wheels to cover and protect yourself from falling debris if necessary. There's a lot of things you can do. You know your own situation, or the elderly know their own situation. The more they're aware of what their limitations are, what their assistance they're going to need, the better off they're going to be able to go through. So next slide, please. So assessing, well, I guess you're there. Assessing your needs and understanding what your medical and cognitive needs may affect your ability to respond to a disaster. Think about how you would respond and consider the needs you may have if the power went out. What you would do to stay home, like again for COVID, if for a couple of weeks or longer. Would you have the supplies to suffice? Would you need to evacuate? And do you know how to evacuate quickly from your home? Those are important things to do. Take an inventory of items like assisted devices, or rely on a home that you may need, if you had to evacuate, things that you may need to take with you. You know, one of the things that the Red Cross does is we do provide folks that are hard of hearing or limited hearing. We have what we call a shake or smoke alarm. It works in conjunction with regular smoke alarms. But if they're leaving their home, I always tell them, if you ever move or you leave, take it with you. You know, don't take the one off the wall or the ceiling, but take the shaker with you, because it's a little bit, it works in conjunction with the normal smoke alarm, which detects it. But that's a piece of equipment specifically for them because they have a hearing loss on it. So think about that kind of equipment that you would need to take with you if you had to evacuate your house. Think about all the things that need electricity, refrigerated, medications, CPAPs, power devices, oxygen. Those are kinds of things that as older adults, they need to consider that. You know, not that younger folks don't have to, but we tend to, as we get older, we need those things a little bit. But think about, again, your situation. Make a list of all those devices and what you're going to need to make those work if you had to evacuate or if you had to stay in place. It's important. Plan for a battery backup or a generator and know how to work the generator. So often people, they think they're great and they have a generator and they put it in their garage and they power it up, and then they have a carbon monoxide problem on top of everything else. So it's not only important to have these items, but know how to work these items so they can do those. And again, that's something your support network can help you with. And that's what we're going to do. So building that support network is important, and it contains all the people that would help in an emergency. Can be family members, caretakers, neighbors, other loved ones who can help, and that can be close at hand. And also out-of-town contacts could be just staying in touch with them by phone or internet or whatever. Identify those helpers, and, you know, include family, friends, neighbors, caregivers. Meet with them, plan together. When you make your disaster plan, include them in it. So they know what your plan is, what you plan to do, and they can help you assist if necessary. And then make contact information lists for your helpers, not only on your internet, on your cell phone or your smartphone or device, but having a hard copy. And as I mentioned, in case you lose that or the power goes out, that you have a phone number or whatever. And so we're going to talk about some disaster plans for specific disasters and emergencies on it. Next slide, please. And as I mentioned, plan to stay or plan to go. It's important that you'll need to stay home for at least 2 weeks or evacuate. And if you need to do that, consider what you're going to need in types of disasters. Again, listen to the authorities. They're going to tell you the safest thing to do, if it's to evacuate or to stay home. Plan to help, plan for help to stay home if you're staying at home. Plan how you're going to meet your needs if your caretakers or care providers aren't able to come to your home. Can a neighbor help you? Or can you can't get that access to essential medical community needs. It's important. Like I said, COVID was sort of a wake-up call in a lot of the plans, because we found out there were a lot of holes in a lot of our plans. And people struggled for the first couple of months of it, which is important. So you may need to have a plan to evacuate before a disaster. Even if they're telling you to stay in place, it may not be safe for you specifically. And maintain that access to support to identify a friend near nearby friend or neighbor who can help you evacuate. And if they need to do that, if you need help in evacuate or have that medical devices that require power, plan for help. Find out if there's local registries and sign up for local responders that they're aware of your needs on it. Next slide, please. And other things to think about in your plan: assess your power needs, as we just mentioned. If you require power to operate those medical devices or keep medicines cold, talk with your care providers or utility company. Make sure talk about a power plan, backup plan if necessary. Learn how to turn off water and gas. I don't really advocate folks doing this too much because if you turn them off, you got to have a professional turn them back on. And not all, let's be honest with you, not all elderly people are capable of doing that. So I downplay it. It's a suggested item to do if you are capable to do that. But we always tell people that if you need to evacuate on it. Because if your gas is turned off, only a gas utility professional can turn it back on. Prepare for home fires. Like I said, the #1 thing that could affect anybody's home, not just the elderly. Make sure you have a smoke alarm, a carbon monoxide detector on every floor of your home, inside the bedrooms and outside of sleeping areas, especially if you sleep with the door closed. You'll see on the slide there where the gentleman is pushing with a broom. The Red Cross installs smoke alarms for folks. And I always tell people that minimally, monthly, and this is for everybody, you should be testing your smoke alarms monthly. And a lot of people say, yeah, okay, great. And the reason I tell them that, to put it in context, they'll understand, think about if your computer ever locked up. It's basically by testing it, by pressing the alarm, letting it go off, you're rebooting that piece of equipment. And it's good for it. And smoke alarms have a life expectancy of 10 years. We're now providing alarms that have a 10-year battery as well, but the battery has nothing to do with the sensors. The reason smoke alarms have a life expectancy of 10 years, it's the sensors go bad. So when we tell people to sell, especially elderly, to test your alarms monthly, I don't want them getting on ladders, because then you as responders are going to respond to a lot more falls off the ladders. So we tell them, get a broom, a cane, a stick of some sort, press the button, don't go on a ladder, sound it off. It does two things. It resets that sensors inside of it, and it also gets them used to the sound. So if they ever hear that sound, they know what to do. It's not just going off for for kicks and giggles on it. It's going off for a reason, especially if a smoke alarm starts chirping. It's telling you that something's wrong. Either the battery's going, the sensors are going, it's in the wrong place. I was in a home yesterday that there was a smoke alarm in the kitchen. And even though most home fires start in the kitchen, it's the absolute worst place to put a smoke alarm, because what happens, it's going to go off all the time. And then what people do, they take it down. So now they don't have a plan. A smoke alarm is actually the second line of defense in home fire safety. First line of defense is education, because if something went wrong, the smoke alarm is going to go off. Again, so prepare for home fires. Know 2 ways out of every room. Think about when you do your plan, do you need assistance or do you need to assist somebody else? It's important to do. And we're going to talk about more ways to plan on the next slide. Next slide, please. Know your property renter's insurance, especially. I always advocate for folks, make sure you have a written lease agreement from your landlord. It's, don't just do verbal. So often we see people get caught in a jam because they don't have a signed lease agreement. Their landlord could literally raise their rent every month if they wanted to, because there's nothing documented on it. So know what your renter's insurance is, know what the lease agreement is. Protect their property. Those are part of those important documents we talked about when we do that. Next slide, please. Important thing, as I mentioned earlier, communication plan or information is the #1 thing people need in a disaster. They're saying things that we can do in mitigation of avoiding a disaster if needed. Things like floods. If your basement floods all the time, maybe, and you lose your furnace and everything in the basement, maybe there's a mitigation way. You move the furnace out of the basement so that you don't keep going back to the same disaster over and over again. But communication plan, develop it. Share your plan with your contact information, your support group. Learn how to use alternative communication aids. Again, for seniors, having a cell phone, having the internet, just talking to your neighbor, having a neighbor be your buddy system type of a thing. Know how to do those things. Know how to use email and internet, text if necessary. Those are important things to do. That's how our country, that's how the world communicates now. And we need to get into that mode. Write down those phone numbers again, and the emergency services numbers, the utilities, your service providers, your caretakers, any of those, your doctor. And so that if you lost your phone, that you have those numbers to go back. Next slide, please. So it's important to gather supplies, and that especially if you have to stay at home, like a portable kit. We say to have a go kit of things that if you had to evacuate, you can grab and go pretty quickly. Everybody knows where it is in the family. Includes basic items like food and water if necessary, a first aid kit, the simple things like flashlights, a whistle, especially in tornadoes, if you get trapped. Cash, actual cash. Think about it. If you didn't have power, when we deploy people nationally for disasters, we tell our volunteers, take some actual money with you, because if you get to an area, a disaster area, there may not be ATMs, and there may not be electricity, and there may not be banks working. So having some actual cash in your emergency kit is a smart idea. A change of clothes, sturdy shoes, depending on what kind of disaster could have hit. Phone chargers. A lot of times we grab the phone, but we forget the phone charger. Those are things. Backup batteries for those. And then even things like flashlights or radios that you put in an emergency kit, don't keep the batteries inside those items, because if you've ever had a flashlight that's been on the shelf for a year and you never look at it, and then you go to use it and it doesn't go on, is because the battery's corroded in it. So have batteries in there, but have the equipment with it. So there's a lot of basic items that, if you go to redcross.org, there's a tons of things. Again, think of your specific areas. Next slide. Personalize your kit, especially for your medical needs or those needs of people in your family. Gather those items for yourself and everyone in your household before disaster help. Include your pets. The number one thing we get in emergencies when people evacuate to shelters, they want to bring their pet with them. If it's a service animal, not a problem. We'll let a service animal in. But we can't take pets in a public shelter for health reasons. But what are you going to do with your pets? Have a plan for them. Have some supplies for them if you're, if you evacuate or if you shelter in place on it. Keep it like kit. Next slide. So there's a lot more things you can do. Locate those important items we've talked about. Gather that medical information, keeping it up to date. Keep an eye on that contact list and keep that up to date as well. Keep a copy of your plans. Share your plan with your family. Safeguard those documents in even in a fireproof box. Have a second set of those off-site with a neighbor or friend that you can trust. There's a lot of information about emergency preparedness that you can go. Next slide. So those are some concrete things to do. But during an emergency itself, it's happening. There's some things that we can do is staying informed. Monitor the TV and the radio and the emergency watch. Know what a warning, a watch and a warning is. Know to take action for yourself. Think of the immediate dangers and some of the response skills that you've learned in your planning, in your training that you would do what to go. Do you need to stay or go? Do you evacuate or do you shelter in place? It depends on the situation and what the emergency management people say, the authorities say. Locate those public shelters. And so often we get people ask us, where's the shelters? And I'll tell you, there are a lot of community buildings, but it doesn't mean we're going to open every one of the shelters on list. We will communicate that through emergency management, the first responders, through agencies like you guys. We'll let you know where those shelters are going to be when we open those, because we may not open them all. And then know how to tell people. And so often seniors don't ask for help because they think they can fend through themselves. But there's no shame in asking for help. It's important to do. And I think some of the speakers mentioned that earlier. It's important that people take care of themselves and look at all the resources at their availability. Next slide. So things to do after disaster is, obviously, return home safely, work with trusted sources. So often we see in disasters, after a tornado or high winds that, we get people, contractors that go door to door and they take advantage of adults. So only work with trusted sources that the local authorities and so forth. Like groups like the Red Cross, like the Department of Aging, a lot of those, FEMA, they're good ones. Work with your property managers if there's damage in your insurance company, even renter's insurance. A lot of times renter insurance isn't very expensive, but think about it. If you lost everything as a senior, if you lost everything you had in your apartment due to a fire, where are you going to start? So having renter's insurance, it's not going to replace the building, but it can replace your belongings. Even if you're a renter, it's not that expensive. I know a lot of seniors are on fixed incomes, but it could be a godsend in an emergency. If there's, next slide, if there's an extended power outage, know how to throw out food. When in doubt, throw it out, as we say. There's between 40 degrees and for 2 hours or more. If it's been above that 40 degrees for over 2 hours, throw it out. It's the worst thing you want to do in an emergency or a disaster is get sick. So again, be safe be smart for yourself. Be aware of risk of electrocution. Like I said, know how to work a generator, where the proper place to do that. Keep generators outdoors, away from windows, so that you don't have carbon monoxide problems on top of that. Next slide. Document any property damage. Take pictures. Let your insurance file those insurance claims on it. If you're cleaning debris, be careful. Follow safety precautions. Wear protective clothing. Always work with somebody with safety. And then again, lean on that support network that you have. Next slide. So finally, there's a lot of things that we talked about. Understand what may be expected and required to do for assistance for your caretakers. Keep them, make them part of your emergency plan. Ensure that you're receiving training in things like first aid or CPR. Know how to teach others to communicate effectively. Know how to provide some emotional help that was mentioned earlier. Disasters or emergencies are stressful. Know what the signs of stress are and some things that you could do to prevent that by eating, getting rest, taking a break, talking to others. Those are all things that can help you alleviate some of that stress. Take current pictures of yourself, your pets. One thing I always tell people with their pets, take a picture with you and your pet in the same picture, because if your pet gets displaced in a disaster, you're going to be it'll be easier to get you reunited with that pet if necessary on that. And next slide. Red Cross has a lot of apps and there's 35 different apps. They're free, they're downloadable. If you go to redcross.org, you can get everything from fire safety to tornado safety to senior safety on these are free, downloadable, going to the Red Cross. Next slide. And in closing, there's a lot of information on there. There is, to get this information, go to redcross.org/older adults, and you'll get this and a ton of other things. And if you, again, going back to fire safety with smoke alarms, if you or anybody knows, needs a smoke alarm, Red Cross provides them free. We don't just provide them, we install them, and we work with first responders, fire departments, our partners. There's an 800 number I'm going to give you. It's 833-431-0725. You can dial that number anywhere in the country. It'll prompt you for your zip code, and it'll direct you to the closest Red Cross, and we'll provide you free smoke alarms. Like I said, and we in Northern Ohio are blessed. We have a lot of fire departments that work with us, where the Red Cross provides the alarms and the fire department installs them in the proper places, which is important to do. So thank you very much. If anybody has any questions, I know it's like throw a lot of information there. Probably lost some of you guys, but.
Any questions? All right, well, thank you very much, John. We really appreciate you being here and giving us that information. That is fantastic. I mean, our seniors are going to get a lot out of that.
It's good. I think that's something that, they have other things to think about other than just anybody. We have health issues, maybe, living by themselves, mobility issues. Those are kinds of things that they're realistic things that we need to take in consideration. Doesn't mean that, poor me, throw your hands up and, rely on somebody else. The more we can be reliant on ourselves and the more capability we are, you're going to gain your freedom back. That's the number one thing people want is, to get back to the normal as quick as possible. And there's a lot of things we can all do to make ourselves safer and our families safer.
Fantastic. Thank you. Appreciate it very much. All right, well, next up is going to be Lori Smith. She is our training coordinator at Direction Home, and she is going to talk to us some about falls prevention.
Thank you. I get to share my own screen. I always feel kind of powerful when I get to share my own slides. So yeah, my name is Lori Smith. I am the training coordinator with Direction Home. So that is all things education. And part of that education is our health and wellness programs. And that's what I'll be sharing with you today. I'm going to be touching a little bit on what Tracy shared as well. The first thing I wanted to talk about is why we need these falls prevention programs. And I know I'm going to be preaching to the choir here. You guys know this data. But I did want to look at a study that was done by the Geriatric Orthopedic Surgery and Rehabilitation Center. They published this study in 2018, and they looked at a medium-sized suburban neighborhood. And what they were looking at, they wanted to see if the falls calls, lift assists, and the need for transport to the hospital over a 10-year span had the same rate of increase as the population rate increase in that neighborhood. And then they also estimated the healthcare cost for those lift assists. They did it over a 10-year period of time is when they gathered that data from 2007, I'm sorry, to 2017. And they looked at solely older adults, 60 and over. And what they found in that entire 10-year span of time, that 11.5% of all the calls they received were related to falls in some way, shape, or form. And where they saw a 15% increase in the population rate, and again, this is just in that town, that suburban neighborhood, there was that 15% increase in population, and you can see that represented by this dotted line here on the chart. So fairly stagnant. It grew a little bit, but fairly stagnant. There was a 268% increase in the number of falls-related calls. So you can absolutely see here that the number of calls related to falls skyrocketed far and away above the population increase. When they looked at transport versus lift assist, the transports significantly decreased over time, while those lift assists almost doubled in number. So, you know, those were the ones where they didn't need taken to the hospital, and the emergency crews stayed there with them, helped them back onto their feet, made sure they were okay in that immediate time, but then that was it. This compares all of that together. So if you look here at this solid line, that was the total number of calls related to falls in that 10-year period. The line just below that was those lift assists, those ones that they helped them get back up on their feet and in a safe position, but didn't take them to the hospital. And then this line here that declines significantly is that transport rate. When they looked at the cost of care analysis, they averaged that each and every one of those lift assists costs about $825. And those costs are, of course, absorbed by the taxpayers of that town. And over that 10-year period, that came up to a total cost of $1.5 million over the 10-year period of time. And of course, that is, again, that mid-sized suburban community where you think we've got this great healthcare system. We have the tax dollars there to take care of that, but still 1.5 mil, it's a good chunk of money. So after looking at all this, we can clearly see that these lift assists are very costly. And you know as well as any of us realize that it really truly diverts the care. Time spent in doing these lift assists in preventable falls could really be easier used, or better used, I should say, for true emergencies. And there's usually no significant intervention after a lift assist occurs. You know, you get in there, you make sure they're okay, you get them upright, but then that's pretty much it. And then they're, back in the same situation. And what they found in longer term studies is that 50% of those patients who had that lift assist done have a subsequent EMS evaluation within 2 weeks after that initial fall. And then more than a third had a further emergency visit or even died a month after that initial fall. And that rate increases to 2/3 of patients within a 6-month span. So then our question is, what do we do about that? How do we reduce the number of calls coming in and reduce the number of lift assists that are occurring? Well, Direction Home can help with that, as can every other area agency on aging in the nation. So as I talk about our programs, I also want you to keep in mind that if you have a friend or a family member in an area that Direction Home doesn't directly serve, and we cover Stark, Summit, Portage, and Wayne counties, please know that other AAAs also have these falls prevention programs. They may not be the exact same ones that Direction Home has, but they do have falls prevention programs, and they are all evidence-based. The 2 falls prevention classes that we have is a matter of balance. And then we also offer Taiji Chuan, moving for better balance. And the target population for these classes are those community dwelling older adults who are at a higher rate for risk of falls. And they are free for those folks to attend. So we don't want them ever to think of cost as a barrier to attending these classes. Right now with COVID, we are doing them virtually, but typically they are done in person. The first one we'll look at is a matter of balance. It is led by 2 trained and certified coaches, and we do ask that they are volunteer coaches. Many of the coaches that work with us, they are professionals in some way, shape, or form, usually in the healthcare field. But when we are leading these classes, we ask that they take that professional hat off and they become true peer educators. A Matter of Balance is an 8-week program, and we visit with each other once a week over a span of time of 2.5 hours each session. They are held in groups of 8 to 15 participants, and we want that size of a group, one, because there's a lot of idea sharing and we do some brainstorming. So we want the group to be large enough that they get a lot of various ideas to help solve their concerns, but not so large of a group that they feel maybe intimidated to share their ideas. And what it really looks to do is break the fear of falling cycle. And if you look to the right there, that is the fear of falling cycle. And it can start at any point in this circle. But if we start with a fear of falling, so someone has a fear that they will fall, then they become more inactive, because the more active you are, the more you might fall. You might do something that causes you to fall. So you become more inactive. And that, of course, then leads to physical deconditioning. Your muscles get weaker, your bones become less dense, which then puts you at an increased risk for falls, right? So if you have that increased risk for falls, you're probably going to have an incident of falling. And if you fall, then you have a fear of falling, and round we go. Matter of Balance looks at breaking that fear of falling cycle at any point in there. And we call it a toolbox. It's various strategies to be used to break that fear of falling cycle. And we offer, again, a number of tools, because we also know that what works for one person might not work for another. So we want to give them options to really choose what works best for them. And then in week 3, we start to introduce some small movements that strengthen your muscles and increase balance and flexibility as well. All of them are fairly simple to do. They can all be done from a seated position, or when we do stand up, they can be done right in the spot where you were sit. We usually stand behind our chair. But if there is any functional limitations, they can all be done from a seated position, so they can be modified. The outcomes of Matter of Balance workshops, of course, we have that decreased risk for falls. Folks who participate also have an increase in their confidence levels, so they feel more confident in going out and taking that walk or visiting a friend where they have to go up those front steps to their front door. And then socialization, we know that older adults are at a higher risk for social isolation in the best of circumstances, and even more so now with COVID. So we want them to get out and have that socialization. Tai Chi Chuan, Moving for Better Balance, is our second falls prevention workshop. It is led by a single trained and certified instructor, although we do have the option of doubling up. It is a 24-week program. We meet twice a week for an hour each, and it is strictly movement-based. Again, in groups of 8 to 15 people, and when we are in person, we just ask that the room is large enough to be able to freely move and not knock into your neighbor there. But again, right now we are doing these virtually through Zoom. And it is based on Yang style Tai Chi Chuan, but the movements have been modified a bit to really focus on older adults with that increased risk of falls. So if anybody here or any of the participants have been formally trained in Tai Chi Chuan, it's not going to be an identical practice. It's not a strict martial arts practice. It has been modified. The outcomes of Tai Chi Chuan, Moving for Better Balance. We gain lower limb muscular strength. So we really work on the core and those larger leg muscles. Sensory integration. And what that simply means is kind of knowing where your body is in space without looking, okay, my hand is placed over here. You just get a better feel for where you are in space. Your limits of stability. So we work on balance a lot. This program actually, yes, we focus on the center of gravity, but it also will purposely bring your center of gravity forward, so it's not centered, or to the side, because we want people to gain that strength and know how it feels to be off center, so they get that muscle memory of bringing themselves back to center. And then global cognitive function, being social and really learning new ways to move. And we tie them into your daily functional activities, and just different ways of thinking about things gets that cognitive function really increased. And they have seen through this program, there is a reduced incidence of falls by anywhere from 55 to 58% in community dwelling older adults, and by 67% in people with Parkinson's disease. So it's quite a reduction in those falls. If you have any questions about either of these programs or any other of our health and wellness programs, please do feel free to give me a call. I will also throw out a shameless plug. We are always looking to build our coaching staff. So if you are interested in possibly leading one or more of these classes, give me a call and we can talk about getting you trained. There is my email address and my phone number. I would be thrilled to hear from you. Are there any questions at all? I'd be happy to answer. You guys are an easy group. I could throw out all kinds of information and nobody would ask a question. All right. Thank you so much. I appreciate your time.
Thank you, Lori. Appreciate that very much. We will be sending out the video to the rest of the first responders and PIOs on our contact list. So if you have a colleague or a friend who is on that list, let them know that they will be getting the information. And we appreciate your time, especially at the beginning of a holiday weekend, and enjoy it very much. Thank you, everyone.